Danielle Smith has proposed a policy that could be the death rattle of universal public health care in Alberta. Welcome to whatever the this is. I am Zane Velji. Today, we're talking about healthcare, the career my family wishes I had done instead of this. Danielle Smith has introduced something unprecedented in Canada. In a 7-minute video that looks like a funeral director casting tape, Smith and her one-third health minister pitch more private care with one policy Canada has never seen before, letting doctors simultaneously work both in the public and private systems. What they do not say in this video, it will gut universal public health care as we know it. Danielle Smith says other countries do this.
Health systems in Western Europe and Japan.
Okay, Japan. It has more than 80% private hospitals. They spend more than Canada does on healthcare, rank below Canada on access and equity. Spain and Italy let doctors work in both systems. Public waits went up 30 to 50% because exhausted doctors followed the money into private care. And that is the warning. You don't notice the collapse all at once. It happens slowly and then suddenly. Like grocery stores. One day, a human checked you out. The next day, you're a droid scanning the PLU for bananas. Shout out to my 4011 people. Without thinking, what's a PLU? How did we get here? And why the am I doing this? Except this is not bananas. It's your healthcare. And it's bananas that it's your healthcare. Under Smith's rules, doctors earn more by offering private care. The slower the public system gets, the more demand the private side receives. So the two groups who could fix healthcare now have incentives not to fix it. Hardworking doctors, deliberately or not, profit when the public system is slow. And the government can claim savings when people give up and pay privately. And this is how universal public healthcare dies. Canadian author Cory Doctorow calls this enshittification. Early promise, then locking you in, then regret, then a hollowed out version of what used to exist. Portugal and Italy show the pattern. Early stability, then staff drain, then rising waits, fewer family doctors, and a decade later, a weaker public system everyone regrets. Smith will use the first year to pretend it's a success, maybe even try to win votes, say taxes will go down. But total costs, they'll go up for Albertans. Ask Americans, when you count healthcare premiums, they pay more taxes than us. What your taxes once covered now comes with the work of planning for healthcare, draining your time, your mind, and your money, all while the public system gets damaged. The death rattle of universal public healthcare. And if you believe in what makes Canada Canada, the time to fight is right now. Which is why we've started a new campaign at no2tier.ca. Not just to stop the policies of Danielle Smith in Alberta, but to promote universal public health care, a core Canadian promise.